Welcome back to the podcast, Heal Without Harm. My name is Dr. Clayton Dir, physical therapist, and the one bringing you the truth about the medical system. Today's podcast is the final one of 2025. The podcast after this will be the first of 2026, and that will wrap up my first full year of podcasting. And I want to share with you what I usually see as the journey that patients go through to get to a physical therapist like myself or another good quality physical therapist that is generally in the cash-based realm. There are still plenty of fantastic physical therapists that are in network or in network with your insurance, but oftentimes I see people getting much more results by and large at a cash physical therapist. This is going to be a mix of frustration that you'll hear coming through my voice, but ultimately I want to tell you my mission is to get as many people out of the pharmaceutical, medication, injection, and surgery route when it comes to their pain, whether it be knee, hip, low back, upper back, neck, shoulders, elbow pain, all that kind of stuff. My goal is to get people out of the pharmaceutical realm and into physical therapy. But this is where I notice a lot of patients that I talk to, whether it be through social media, on TikTok, on Instagram, on Facebook, through YouTube comments, or if it's seeing patients of mine in the clinic. Ultimately, what I find is step one is getting the conversation, getting the person to ultimately have the conversation of, I have pain and I should do something about it. If you're a female listening, you probably have a guy in your life, and maybe a dad or a husband or a brother or something like that, that is just too stubborn to go to the doctor in the first place, to go and ask for help from anyone in regards of pain. They'll just put up with it. They're fine. And you know what? I fully understand that as a guy. However, if you do get them to go somewhere, it's usually hard to get them to go to someone who is truly going to help them, as opposed to just going to the regular medical doctor for some like pain medications, right? But ultimately, the first step is just getting them to ask for help, or getting yourself to ask for help. Honestly, that's what I like about podcasts is it is information that you chose to listen to. And so anything that you receive from that podcast, and this goes for books too, and a bunch of other types of content, anything you receive from that feels like your idea because it is information that you sought out or sought after. And that opens the conversation to, okay, I think I'm going to do something about this. I think I'm going to see if I can help heal myself. I'm going to see if I can get this evaluated so I can understand exactly what is causing my pain, instead of going to WebMD or Googling it and coming up with, I have cancer, or I probably just need a total hip. I know I'm only 38, but I probably just need a total hip. And it's like, can we verify that can we verify the exact tissues that are playing into this? Anyway, first step is getting help, just getting some sort of an evaluation. But immediately you're faced with the question of, who do I go to? Because I've answered 2 different Facebook posts over the last week of, I have blank pain. Who should I go see? Should I go see an orthodontist? Should I go see an orthopedist? Should I go to my regular medical doctor? Should I go to a physical therapist? Should I go to a chiropractor? That is the question. And I'm happy that we're having this conversation because ultimately you've now admitted, okay, I'm going to go somewhere. Who should I go to? And I'm going to run through the potentials. So you go to your medical doctor. Most of the time, that medical doctor is going to not see you for very long, just because the system that they're in. Now, if it's direct primary care, that's a different conversation. But that doctor is probably only going to get 3 to 5 minutes with you on average. They're going to say, okay, here's some anti-inflammatories and some muscle relaxers. They're going to recommend an x-ray. The x-ray is probably not going to show much. And if it does, I can show you some stats on how predictable that x-ray is going to be just based on your age, whether or not you have symptoms in the area. And then they may or may not recommend physical therapy for you. This kind of depends on their background and also, like, honestly, how old they are, not age-wise, but how many years they've been in the business. Because generally the older ones will just recommend you on to an orthopedist. So you're going to be going to either a surgeon or just an orthopedic doctor. And of course, if you go to a surgeon, they're probably going to recommend surgery because that's how they help people in general. If you're a hammer, everything looks like a nail. And hopefully along this way, the first doctor or the orthopedic doctor is going to recommend physical therapy. And when that is presented to you, please take that recommendation not lightly. Please go ahead and go to a physical therapist. Now we're at stage 2. Okay, cool. I'm going to go to a physical therapist is where you are now. This is where I want everybody to be. I'm going to go to physical therapy now. The downside is what I usually hear from this group of people. Again, most of this is my research via TikTok comments and TikTok DMs and Instagram DMs and Instagram comments, Facebook, all of those. And then having communication with patients in person is once they finally have decided or have been told and they're going to go pursue physical therapy, it's who do I go to? And ultimately, it boils down to find a person, honestly. It is find a good physical therapist person, because I've seen really good PTs in very bad clinics and they can only operate so well, or they're standout, they're amazing, but they're clearly the only one that operates like that in the whole clinic. I've also seen really not as high quality PTs, or I've heard stories of not as good high quality PTs in really good clinics. And so honestly, treat your physical therapist like you treat your realtor. Find the one that will go to bat for you. Find the one who is going to not sleep at night until they have helped you figure out your pain and get you to the goals that you have. And that's a huge one. Get you to your goals. Not, oh, insurance stopped pain. Not, oh, you can walk now, so you should be fine. Not, oh, well, you run, so at least you can run. It's like, no, I want to run a whole half marathon. I want to run an entire marathon. Like, if that's your goal, let's get you to your gosh dang goal. So start asking people, put it on Facebook, ask for Facebook recommendations, like ask friends, ask Facebook groups, DM clinics and ask them questions, like call the clinics, do some research. Treat finding a physical therapist like you are hiring a contractor to work on your house. Like, I know if I'm going to get a fireplace installed in my house, I am going to probably talk to 2 to 5 contractors. I will ask them all, how much is this going to cost? How is this going to work? How long is this going to take? Do you have any reviews? Do you have pictures of other like fireplaces that you've done? I'm going to do some research. I was just talking to my brother today, who is a tattoo artist. And we were talking how different people will show up and ask different questions. People will think a tattoo artist at $150 an hour is expensive, and others think they should charge more. Everybody has their own perspective, but now I'm getting off track. But ultimately, you are going to do your research before you let somebody tattoo you, right? You're going to do your research before somebody puts ink into your skin. You're going to do your research before somebody starts hacking down walls in your house. You're going to do research before you buy a vehicle. You're going to do research before all of these things. Do the same with your physical therapist. Do the same with your doctor, with your surgeon. Like, these people are going to be working on you and your body. They're going to be working on you and your mind, because a lot of pain has psychosomatic aspects to it, which means it like how you think about your pain matters significantly. How you think about your recovery matters significantly. How you talk and how open you are with this person matters so significantly. So please, not only do I want you to go to a physical therapist, but I want you to find one who is going to go to bat for you and who is going to like truly be invested in your success, in your pain relief, in your goals, ultimately. So again, stage 1 is you should go to physical therapy for most, if not all, of your musculoskeletal pain, muscle pain, joint pain, back pain, ligament pain, all that stuff. But 2, once you've decided you're going to go to physical therapy, find a good physical therapist. And if you need help with that, reach out to me somehow, some way. Message me on any of the social medias, email me, contact the clinic, Natural Wellness Physiotherapy, whatever you need, we will get you in the right direction. I have helped probably for sure tens, if not hundreds of people through TikTok and through the connections that I've got, find good physical therapists within an hour of their house all across the contiguous 48 states. Which has been really cool to see, honestly. So making sure you find a good physical therapist is so important, because in our clinic, I think that me and the other 2 PTs in our clinic operate really well. And I think that should be the standard. And I forget that it is not the standard when I hear the stories of patients who come in and say, I saw 4 physical therapists in a matter of 6 visits. I was there for an hour at my visit and I was only with the physical therapist for 20 minutes. I've heard stories of patients who come in after they went to like 2 months of PT somewhere else, and I say, can you please show me your home exercises that they gave you? They continue to show me 9 different exercises, none of them addressing the muscle that I believe and have diagnosed to be the problem. None of them ultimately attacking that specific muscle and helping it get stronger. And that those 9 exercises take 40 minutes. I wouldn't do that either. If I was getting zero relief and I was taking 40 minutes a day to do these exercises, I would quit as well. I fully would. I totally get it. When you come to our clinic and you get treated by me, you are going to know exactly what is going on, or at least a very good understanding. You are going to know, I'm going to work on these 3 things. It's going to take me 10 to 15 minutes at most. I'll do them daily or every other day, and I will feel relief. If I'm not handing you that, please find someone else who's going to help you with it. Because ultimately, you are asking for a result that you are going to be the one putting in the work. You are getting diagnosis and guidance by the PT, but ultimately, you should be getting results. And if that is not taking place, you need to have a good conversation with your PT, or you need to find some other medical professional who will help you. Thank you for coming to my rant, ultimately, is how this feels. But gosh dang it, there is a lot of people who could save a lot of time, money, and heartache by finding a provider who is going to help them deeply, whether that be a PT, whether that be a chiro, whether that be a nurse practitioner, medical doctor, doctor of osteopathy, whatever it may be. Please find the person that's actually going to help you. And please, if needed, let me be the person that helps you find that human for you. I appreciate all of the support that you have given me this year. I hope 2025 was good for you. It has taken a lot for me to stay persistent and consistent with this podcast. This marks 1 full year of podcasting. If you have not yet, please leave me a rating and a review on either of the podcast platforms, whether it be Spotify or Apple. Apple is much higher, and I appreciate that. If I can get my Spotify numbers up, that would be fantastic, because we continue to move up the ranks. Again, my name is Dr. Clayton Dir, physical therapist, and the one really bringing you the truth about the medical system. I anticipate this next quarter, if not this next half a year, to be a lot more patient heavy in regards of patient success stories for my podcasts, and also medical providers. We're going to be bringing some old guests back on. I will have some new guests for you. And there are some people who are trying to make big things take place here in Wichita that I hope to also get on the podcast and help you guys get some more connections and ideas of ways that you can help yourself or help others in your life, ultimately, that you love, get good medical benefits. Hopefully today's podcast is going to teach you a little bit more how to heal without harm